my name is Kevin. I'm from London, UK. I'm really happy to take my new voice.
My problem started when I was 12 years old.
This will definitely motivate people who are suffering from similar situations.
I have high pitch voice problem.
तो अभी तो सर मेरे को बहुत अच्छा लग रहा है, वॉइस में काफ़ी फर्क आ रहा है.
Okay. I actually had this surgery in the back and
You said, I'll take it as a challenge and I'll give you your voice back without any invasive procedures.
After surgery, I have vocal cord paralysis. And now I can speak normal. I feel good.
Hi, I'm Cyrus. Hi, my name is Cyrus.
Hi, I'm Chong. Now my voice has recovered and improved.
इसलिए मुझे बहुत ही प्रॉब्लम, मैं पहले से ज़्यादा बेहतर महसूस कर रहा हूँ.
My name is Rehabilitation from Bangalore.
And I'm very happy that I'm speaking like a normal people with a bass voice like male.
So I'm having this voice problem. I spoke with a few of my friends and they found reasonable changes in my voices.
I've been facing difficulty in speech. You are able to speak words properly and sentences properly.
Just you try to say something.
treatment is set there. After 2 hours I got my voice.
Hello friends, welcome to our YouTube channel SLP Sanjay Kumar, Voice Therapist, and today we are before treatment live with Nika Varmashvili, and he's not in India, he's in a different country, and he's having a kind of dysphonia, and his voice look like high pitch voice sometimes breaks, and the problem he's facing after puberty. So नमस्कार दोस्तों, आप सभी का स्वागत है हमारे YouTube चैनल SLP संजय कुमार वॉइस थेरेपिस्ट पर। और आज डेट है 21 मार्च 2022 और आज हम लोग ट्रीटमेंट से पहले लाइव हो रहे हैं और निका के साथ। और ये इंडिया में नहीं है, इंडिया से बाहर रहते हैं और इनको वॉइस की प्रॉब्लम है और हम लोग भविष्य में ट्रीटमेंट के बाद भी लाइव होंगे, तो आप लोग हमारे YouTube चैनल को सब्सक्राइब कर लीजिए और ट्रीटमेंट के बाद वाला सैंपल जरूर देखिए। सो निका, प्लीज टेल अस व्हाई यू कॉन्टेक्टेड, व्हाट चैलेंजेस यू आर फेसिंग। We are live at our YouTube channel.
Hello. I'm Nicholas Varamashvili, 42 years old, from Georgia. I'm a physicist by profession, and I have my voice problem since my puberty. And because of this problem, for me, it was very difficult to communicate with people confidently, especially in such environment where the noise is loudly. So my main problem now is that my voice is sometimes feminine, low-pitched, and I cannot speak long time, and sometimes I cannot call someone loudly, and which is so badly and suffering for me. So I heard about Dr. Sanjay's therapy from this YouTube channel, and I saw that he is very experienced and he has huge knowledge for treatment of this problem, and I hope that everything will be okay with me as well.
Thank you so much. So nicely you explained your problem, and so in the future again we are going to be post-treatment live also. So those are watching this live, please don't forget to watch his post-treatment live. So for that you can subscribe our YouTube channel and press the bell icon. And in this live we are going to talk a little bit about awareness among the people about the communication disorder, what the NICA is having, why the NICA is having, and why it happened, and what we are going to do in the treatment. In fact, we are going to give all the treatment by online method. We call technically online voice therapy. So the topic we are going to cover in this live will be the high pitch voice sign and symptoms. Dysphonia is a general term, so I have used for your problem as a dysphonia. But if we talk specifically, then it's a high pitch problem, and the loudness and sometimes voice break. So these are the issues. So we are going to talk on sign and symptom of high pitch voice, and the cause of high pitch voice, and treatment of high pitch voice, and we'll talk in the nutshell speech production mechanism, and what are the other communication disorder which we provide our services at our center, like Sanjay Speech Hearing and Rehabilitation Center, which is at Bangalore. And I'm going to give few tips also how to keep your voice healthy. And how do you know if you are in India and taking help from the Indian speech language pathologist? They are not healthcare quacks. They are a real professional. How do you will be knowing? And where to report about the fake speech therapists and audiologists, and why you should not take treatment from the healthcare quacks. And these are the few topics I'm going to cover, but very fast, because after 9 minutes I have my patient therapy as well. So in high pitch voice sign and symptoms, so if the patient is puberty has over, so even after puberty the boy is speaking in a childish voice, and even beyond puberty at any age, but after puberty, so it can be high pitch voice symptoms. And when he will be calling to the phone, sometimes people will say madam, but high pitch voice can be due to different reason also. So understanding the reason is very important. So very simple way to understand: you are a male and your age is more than the pubertal age, and you are talking on the phone and people are saying yes ma'am, so there is just chances you have the symptom of a high pitch voice. And treatment of high pitch voice, first we'll talk about the cause of high pitch voice. So the high pitch voice can happen due to the hormonal issues also, but that is very rare case. The vocal cord will not vibrate in an effective manner. That can be also reason. I have seen the phonatory gap, muscle tension dysphonia. In that case also the high pitch voice will be there. In sulcus vocalis also high pitch voice will be there, where nature has not given the sufficient mass and the length of the vocal cord. So this can be the reason. And I will talk about the speech production mechanism, so that will give us better idea like why the problem occurs. So for speech production, first thing is the thoughts that comes in the brain. Then we take air, that air goes to the lungs. When we breathe out, we put air pressure below the vocal cord. So once you put air pressure below the vocal cord start moving like a string of a violin, and guitar sounds generate. And then we modify that sound into different sound with the help of our lips, tongue, jaw, teeth, palate. These are known as articulators. So once you say one sentence, so many things happen at a time. Thoughts come, we take breath, we put air pressure below the vocal cord moves, sound generate, we modify that sound into different sound. So the speech production is a little complex process. In this process, there are hundreds of our body muscles works in a very, very coordinated way. If coordination among these muscles will not be there, there will be fluency issue. The patient will be having the stammering like a symptom. And the high pitch voice also happen like during puberty. Suppose because of the testosterone hormone, mass and the length of the vocal cord increases and pitch reduces. Means before puberty, vocal cord will be like a thin string of a guitar. But during puberty, due to the testosterone hormone impact, it becomes thick. And thick string of a guitar will produce low pitch voice. But child has spoken high pitch voice from childhood to puberty, and now the vocal cord is ready to produce masculine voice. But because of so many years habit, he will not able to switch on to the new voice. To do that, to maintain the childish voice, what they will start doing, instead of vibrating the whole mass and the whole length of the vocal cord, such people will start vibrating only thin edges of the vocal cords. The vocal cord is actually thick but behaving like a thin string of a guitar. And when the guitar string will be, the thin pitch will be higher, means voice will be more shrill kind of things, like a bell-like sound. Bell sound is a high pitch voice and the drum sound is a low pitch voice. So this may be the reason. And what we do in the voice therapy, we try to stimulate whole mass and the whole length of the vocal cord, which is not vibrating effectively when the vocal cords are normal and when it is not vibrating effectively. So once whole mass will start vibrating, the vocal cord, which was behaving like a thin string of a guitar, will start behaving like a thick string of a guitar. And when the guitar string will be, the thick pitch will be lower. So this is the biophysics behind that. And what are the other communication disorder for which we have the facility at our centers are, to understand that, I'll suggest those who are watching this live, please refer our YouTube channel's playlist. Once you will refer that, you will find different communication disorder playlist, and that playlist will be having pre and post treatment videos. For example, you will find the playlist of vocal cord paralysis pre and post treatment videos. You will find playlist of stammering. You will find playlist of high pitch voice, puberphonia, misarticulation, functional aphonia, functional dysphonia, phonatory gap, spasmodic dysphonia, sulcus vocalis, and after stroke aphasia happened. For that also you'll find playlist, and we do the hearing evaluation and the hearing aid dispensing, hearing aid fitting also. So we work as an audiologist also, because my bachelor degree is in speech and hearing science. Like I did my graduation in the speech and hearing science, Bachelor of Science honors speech and hearing from All Indian Institute of Medical Science, New Delhi, and post graduation I did from the University of Mysore in the field of speech language pathology. So I do hearing evaluation as well, and I dispense hearing aid, and I do hearing aid fitting also. In fact, invisible hearing aid also fit at our center. So just for awareness, and the few tips to keep your voice healthy. So to do that, just drink plenty of water, and once you drink plenty of water, there will be less friction between the vocal cords. So it's very good for your voice. Avoid smoking and avoid frequent throat clearing, like that create a friction in the vocal cord. Avoid whispering like this, "My name is Sanjay Kumar," something like that. If you are doing that, you are putting stress. And when the background noise is more, don't speak too much. So when you are taking your dinner, have some gap between the dinner time and the sleeping time, at least 1 hour or 1.5 hours. So these are the few things you can apply, and your voice can be healthy for longer duration. Even if you are a professional voice user, normal people, or you are a patient, it's good to apply these tips. And how do you know your speech therapist is not a fake speech therapist? For that, first you need to understand where your speech therapist, audiologist, or speech language pathologist has studied. Try to find out the college. Then you find out what the degree is having, and if he's in India, he's registered in the Rehabilitation Council of India or not, if he has a registered RCI number. So just try to find out. The most important thing is the college, because in the name of degree they will write A to Z any letter. So don't believe that. First try to find out where they have studied, and where to report fake speech therapists and audiologists. So Rehabilitation Council of India is the governing council. So once you go to their website, if you are finding any fake speech therapists, audiologists, they are spoiling you. So you can, your voice or your communication, you can report to them, or if they are harming you by any means. And why you should not take speech therapist from healthcare quacks. If you are taking speech therapy from healthcare quacks, it may damage your voice and vocal cords, because wrong way of doing vocal exercise or wrong vocal exercise is equivalent to vocal abuse, and vocal abuse can result into the vocal nodule, muscle tension dysphonia, and vocal polyp, etc. And I have seen a patient recently, and he was suggested some wrong vocal exercise, and he developed the vocal cord paralysis. So when you are going to take the voice therapy or speech therapy, must try to find out actual credential of the speech therapist and audiologist. And sometime I have seen some videos in the social media, the patient is saying in high pitch voice 1 2 3, and the next is telling in the low pitch voice 1 2 3. But just telling single word 1 2 3 is not the end of the treatment. When the treatment is over, the patient should be able to talk in a comfort way in conversation stage. So in that way you can understand the treatment is over or not. So thank you all for joining and watching us. And I have my therapy patient from 12:15, so hardly 1 minute we have. But if any question you have, please write in the comment box. I'll try to give answer in the next live. So thank you all for watching, and thank you so much, Nika, for supporting me for live and helping me to create awareness about the communication disorder. And thank you so much for having faith on me. You are in Georgia, in different country. I'm in India, Bangalore. So in the last, just tell in 1 or 2 sentences, because 1 minute time we have, what exactly problem you have and why you contacted us.
I have puberphonia from my puberty, and
yeah, I'll correct here. I can say untreated puberphonia, because your age is not pubertal age, so puberphonia word is not very technically correct. So you can say I have a childish voice or feminine voice, because puberty is over. You are 42 years now. 42 years, yeah. Please go ahead.
I have my voice problem. Sometimes it is like to feminine voice. I cannot speak loudly, and I have a harsh voice, and I hope that this treatment with you helps me. is for another a lot of patients.
Yes, thank you so much for your faith in us, and we'll do the needful. Thank you so much. And those who are watching this video or this live, please subscribe our YouTube channel, press the bell icon, and don't forget to watch his post-treatment live as well. Thank you so much, and we'll stop this live. Thanks for your faith on us. Okay, this live I'm going to stop now. And thank you all for joining us and watching us. Those who are watching this live, thank you so much.